Good afternoon. My name is Ronelle Baker, and I'm the Healthcare Transition Coordinator with Sooner Success. I'm here today to talk to you about healthcare transition, what that is, and some things to consider when your youth is nearing the age of adulthood. So, what is healthcare transition, or HCT? It is the process of getting your youth ready for healthcare as an adult. It is stated that healthcare transition is an increasingly significant issue, stating that more young people with chronic illness and/or disabilities moving into adult healthcare are more complex, meaning that moving from pediatric care to adult healthcare is more difficult. And so we're here to discuss how to make that not be so difficult. It's also stated that many young adults with special healthcare needs know little about healthcare transition, stating that more than one half feel they are not prepared when they transfer to adult care. So next I'm going to talk about some things that you can consider when your young child is nearing the age of 18. Some of those things could be, what questions should you ask your doctor about transition? Some examples could be, but are not limited to, what do I need to learn to get ready for adult healthcare? Do I have a checklist of self-care skills that I need to learn? When I turn 18, what information about privacy and consent do I need to know? That's both for the youth and for the parents. What are these things that we need to know and that they need to know when they're getting ready to transition? There is a checklist that can be found at gottransition.org. It's called Questions to Ask Your Doctor. I will reference Got Transition a few times. It is a great resource. I highly recommend checking it out. And this is, again, where you can find the questions to ask your doctor. It's at gottransition.org. Next, you can also ask yourself, what changes for your healthcare when you turn 18 or when your young adult turns 18? A couple of things, but not all, are turning 18 means your youth is now legally an adult. After they turn 18, the doctor talks to them, not to you, the parent or the caregiver, unless other arrangements are put into place. Does your youth or young adult know how to find an adult doctor? Here are some tips. Ask your doctor for a referral during one of your visits. Look on your health insurance website for a list of adult doctors. That can be found under internist, family physicians, family nurse practitioners, or specialists if needed. Again, to that gottransition.org website, there is a Finding an Adult Doctor page, and that helps you list out some things and good resources to finding an adult doctor. Does your youth or young adult have an individualized education plan or an IEP? Healthcare transition can be added as a goal on their IEP or service plan. Some examples of those can be, blank will know their diagnosis or diagnoses. Blank will know their doctor's name by such a date or time. Also, blank will know how to call and set up a doctor appointment. The list can go on, and it does not need to be complicated, but it can be on the IEP and something that back at the schools, they can help your child or young adult get ready for that transition and to know these things. Here is a flyer that should have been given out while you guys are here at the On the Road, and it's tips and things to consider about healthcare transition. And it's a twofold flyer. It's tips for families and then tips also for the providers. These are given to clinics as well. That's why there's tips for the providers. But again, some of those things can be, has your pediatrician talked to you about healthcare transition? What things do I need to learn to get ready for adult healthcare? Do you know or have any ideas of adult providers you will transition to? Have you called your insurance company for a list of covered physicians in the area? Again, this has also got tips for your physicians and for providers. And so this is a really great resource to have handy and to utilize. Back to that Got Transition website, they have these assessments called readiness assessments for youth and for the parents and caregivers. Again, that website is gottransition.org. This is just samples of it. There's a sample transition readiness assessment for youth. It goes through questions of their health care, and it says Some of the answers can be no, I want to learn, or yes. Same with the parents. It's sample transition readiness assessments for parents or caregivers. Lists out questions about your child's health care, their health and their health care, and you answer those things. And this just helps get that conversation going of what do we need to get in place to know that we are prepared, that when they are transitioning out of pediatric care into adult care, what do we need to do? What do we have in place? And if we don't have in place, how can we get it into place? Another great tool is for on your young adult or youth's phone, if they have a smartphone. There is this wonderful app. It's a medical ID app, and it can be on the Android or on the Apple iPhones, but it's a health app. And this is where they can put their health information in. They can put in their conditions, allergies, things of that sort. And it's just a very helpful tool to keep up with when knowing what we are doing with our health. Another resource is what are the differences between pediatric and adult health care? There are quite substantial differences, and this list again can be found on gottransition.org, but it says planning to move from pediatric to adult care. Here's how they can differ. And just a few of those examples are pediatric care. Your parent caregiver is with you for most or all of your visit. Adult approach to care, your youth or young adult, the young adult, is seen by the doctor alone unless they agree for you or others to be present. Another example is for pediatric care, your parent caregiver is involved in making choices about your care. When they transition to adult health care, it says you make your own choices about your care, asking your parents and caregivers as needed. One more example, pediatric care. Your parent caregiver keeps a record of your medical history and vaccines. When they transition to adult healthcare, they keep the record of the medical history and vaccines. So that's just some examples. These are great resources and tools that can be found and utilized to just help you through that transition when you're getting ready. This is a wonderful picture of that roadmap. How do we get from point one to point done? And so from the beginning of that, it says, know what age to start. What age should we start thinking about healthcare transition? And that recommended age is between the ages of 12 to 14. And it's actually possibly going to be changing to an earlier age, maybe even as early as 10. So as early as possible, start having those conversations, start having those thoughts. Does my child know what their diagnosis is? Do they know who their doctor is? Do they know their name? Do they know where the doctor appointment is at? Just different things like that. Another step is number 2. And this one is so very important. It says nobody knows the needs of your child better than you, so plan accordingly. There's no truer statement. We as caregivers, as parents, we know our child best. So when they are getting ready for change, we know, are they going to need my help when they transition? Or is this something that they're going to be able to do on their own, that they can learn and make those appointments themselves? Or is this something I'm going to have to help them do that? But plan accordingly. Number 3 is communication is key. Discuss the transition process with your child and the provider. It's always best to have those conversations as early as often as possible, like stated, and just keep those conversations going. Things change from 12 to 16. Things change again from 16 to 18. Keep those conversations going. Number 4, track your health insurance. So important. Know your health coverage for your child. Will it end at 18 or will it carry further on? Will it carry on if they're in college? Know what that coverage is. Or if it is till 18, what's next? When do you need to apply for something different? And then step 5 is if you need help, that's what we're here for. That is what I am here for. You can call me or email me. Again, my name is Ronelle Baker, and my information will be on the next slide. It's Ronelle-Baker at ouhsc.edu. My phone number is 405 862-6682. I am more than happy to help any way I can to get those conversations going, to get you these tools that I've shared on the slides. Any of this information, I'm more than happy to talk with you and help you get started on this journey for your young adult. Thank you so much and have a good day.